Time for StuddyBuddy review. I will be reviewing the topic with you by asking you questions with pauses in between. It's like a virtual study buddy and flashcards for your ears. Okay, let's begin. Osteoporosis. What is osteoporosis? Osteo means bone, poros means pore or porous, and osis means condition. So combined together, osteoporosis means a condition that results in porous bones. Osteoporosis is the excessive loss of bone density due to increased bone resorption. What is bone resorption? Bone resorption refers to the process of breaking down bone tissues and releasing minerals such as calcium into the bloodstream. Cells that are responsible for breaking down bone tissues are called what? Yes, osteoclasts are cells that break down bones and transfer calcium from bones to the blood. Because of the low density and porous bones, what complications can osteoporosis result in? Yes, the main concern and plan of care for osteoporosis is to prevent fractures. In fact, most patients are asymptomatic until the bones become fragile and cause a fracture. Osteoporosis mostly affects big bones such as the hips and spine, and that can result in reduced height and kyphosis, which is what? Kyphosis is the abnormal forward rounding of the spine due to weakened vertebrae. Let's talk about risk factors. What are some non-modifiable risk factors for osteoporosis? Female gender and certain ethnicities such as Caucasian and Asian are at higher risk of getting osteoporosis. What about body sizes? Who is at a higher risk? Small body size or larger body size? Yes, those with smaller body size are at a higher risk because there is less bone to lose compared to larger bones. What is the other risk factor that puts female patients at a higher risk? Yes, postmenopausal patients are at risk for osteoporosis due to low estrogen, which normally helps to stop osteoclasts, which are what? Osteoclasts are cells that break down bones, and estrogen helps to slow down the activity of osteoclasts. What are some secondary risk factors or risk factors that are modifiable? Smoking and alcohol abuse definitely increases the risk for osteoporosis because they can slow down bone growth and interfere with nutrition absorption such as calcium. Some medications can also cause osteoporosis such as steroids and anticonvulsants from long-term use. Let's move on to interventions. Like mentioned earlier, the goal of care for osteoporosis is to prevent and reduce the occurrences of fractures. Exercise should be encouraged in patients with osteoporosis to maintain and increase bone strength. Would you recommend high-impact or low-impact exercises? Low-impact exercises such as walking, swimming, squatting, and yoga, with slow, controlled movement are recommended. High-impact such as jogging or jumping should be avoided due to increased risk of falling and leading to fractures. Teaching patients on fall precautions is also highly tested on this topic, making sure they don't have any loose items on the floor such as throw rugs or cords that they can trip over and fall. Use assistive devices such as a walker or cane, handrails installed in the bathtub, placing rubber mats in the shower, and etc. Other measures include taking calcium and vitamin D and stop smoking and drinking. Let's finish this up with pharmacological interventions for osteoporosis. The first-line treatment for osteoporosis is bisphosphonates. Can you give me some examples of bisphosphonates? Bisphosphonates usually end with the suffix dronate, such as Alendronate and Risedronate. They help to prevent bone resorption, which again is the process of bone tissue breakdown. What is the one unique side effect of this category? Yes, bisphosphonates can lead to inflammation of the esophagus, which is known as what? Yes, esophagitis. ATIS means inflammation. Esophagitis happens with oral bisphosphonates when they get stuck in the esophagus and damage the lining. What can you teach patients on preventing esophagitis with oral bisphosphonates? Yes, take them on an empty stomach with a full glass of water in the morning, and they have to sit upright for at least half an hour to prevent reflux. What is another rare but unique side effect of bisphosphonates? Osteonecrosis of the jaw is a rare adverse effect that causes tissue death in the jaw. Necrosis means cell death, so osteonecrosis of the jaw is the tissue death in the jaw that can lead to jaw pain and infection. Routine dental exam is the key to prevention. Besides bisphosphonates, osteonecrosis of the jaw can also happen in other medications that inhibit bone resorption, such as Denosumab. Denosumab is a monoclonal antibody that is usually reserved for those who failed the first-line treatment for osteoporosis. Calcitonin is also used to treat osteoporosis by preventing bone breakdown and promoting renal excretion of calcium. So the main side effect to monitor for is the low calcium in the blood, which is also called what? Yes, hypocalcemia. What are the two classic signs of hypocalcemia? Yes, Trousseau's sign, which is the involuntary flexion of the wrist and thumb, and the extension of the fingers when a blood pressure cuff is inflated on the arm. And Chvostek sign is the twitching of facial muscles that occurs when tapping on the cheek. They both occur because of hyperexcitability of the nerves due to low calcium level. You did a great job. Like and comment if you want to see more StuddyBuddy series.